आई एम डॉक्टर रजत और एक और शानदार दिन सर्जरीज का। और अभी हमने कंप्लीट किया एक ऑल ऑन 6 सर्जरी। ऑल ऑन 6 का मतलब होता है 6 इम्प्लांट्स हड्डी के अंदर डालना और मल्टी यूनिट हमने डाल दी। इमीडिएट लोडिंग का केस कर रहे हैं। फास्ट ट्रैक इम्प्लांटोलॉजी मेरा फेवरेट है और हमने पहले ऑल ऑन 4 का सोचा था, उसके बाद फिर ऑल ऑन 6 कर दिया इस पर। तो एक अच्छा सिस्टम रहता है वेर कॉटेक्स के इम्प्लांट डाले हैं। मेरे साथ इस समय डॉक्टर अब्दुल्ला हैं जो ओमान से आए हैं। He has done with me, I think this is your
Finally, fourth day.
And yesterday we did 4 implants, immediate loading, sinus lift. He assisted me with the surgery. आज खुद इन्होंने perform किया है. Just want to ask from him, कैसा experience रहा है? How was it?
The experience, hello, hi guys. This experience is very extensive and I have learned so much actually from Dr. Rajat, and there were so many challenging cases. Including this really challenging case of a dentulous patient, very severe bone resorption in the mandible as well as in the maxilla.
Now, what are the challenges that you face in this particular case?
In this particular case, actually, the mental nerve almost on the top of the ridge, and there is an anterior loop to it on both sides. There is very stiff, thick keratinized mucosa because the patient is ex-smoker. And also there is very shallow sulcus depth, very tight lower lip, and very stiff angle of the mouth, the orbicularis oris, which make it very challenging to retract the cheeks and the lips. And also the width of the mandible, there is concavity from the lingual side. So there were multitude of challenges, but the Dr. Raj,
All on 4 guide we used here, and as a prosthodontist you wanted the surgical hand, the free hand where you can perform surgeries. So now you feel that it is easier managing bone expansion, bone drilling, using different systems, and performing your own and doing the surgeries in your own way.
Yeah, I'm really pretty much confident now. I mean, to do it by myself, especially after I have this experience with you, and I have seen so many tips and tricks how to do things.
This is the 4th day, a lot more to go.
Yeah.
You're going to be doing pterygoid implant, zygomatic implant, bone augmentation, sinus lift.
Looking forward for that. Looking forward. That's very highly, very good experience for me. I mean, to do this.
So डन विद टुडे सर्जरीज। अच्छा लगता है जब अच्छे अच्छे मिलते हैं। कुछ ना कुछ रोज़ हमारे डॉक्टर्स थक गए हैं मुझे लगता है, तो अच्छा लगता है जब ऐसी सर्जरीज हों और उसके साथ जब हम अच्छे से उसको एग्जीक्यूट करें तो मज़ा आता है। अब कल एक और केस करेंगे, शेयर करता रहता हूँ, कोशिश करता हूँ एक केसेस। अब मैं दिखाऊँगा सर्जिकल साइड कैसी है। बंद कर दें।